I will say that most people tested positive for leaky gut. Most of the immune system cells are located in the gut. So as a result, you really do need to have a healthy gut in order to have a healthy immune system. There are a few reasons why healing the gut is essential in order to lower and eventually normalize the thyroid antibodies associated with Graves' disease and Hashimoto's thyroiditis. Healing that leaky gut is also necessary to reverse autoimmunity and to therefore lower those antibodies and eventually, again, normalize those antibodies. There are a number of different factors that can cause the leaky gut, and this leads us into a discussion of the 5R protocol, which discusses the different things you need to do to heal the gut. In this presentation, I am going to discuss how to lower your thyroid antibodies by healing your gut. There are a few reasons why healing the gut is essential in order to lower and eventually normalize the thyroid antibodies associated with Graves' disease and Hashimoto's thyroiditis. First of all, most of the immune system cells are located in the gut. So as a result, you really do need to have a healthy gut in order to have a healthy immune system. And then I've also mentioned in other episodes the triad of autoimmunity. So remember, the triad of autoimmunity involves three components necessary for autoimmunity to develop. And component number one is a genetic predisposition. Component number two is exposure to one or more environmental triggers. And component number three is that increase in intestinal permeability, also known as leaky gut. And so that leaky gut is necessary for autoimmunity to develop. And healing that leaky gut is also necessary to reverse autoimmunity and to therefore lower those antibodies and eventually, again, normalize those antibodies. So let me briefly mention what a leaky gut is. Let's explain what a leaky gut is. So you have these tight junctions, and these tight junctions connect adjacent cells of the small intestine, and they prevent larger molecules from passing through. And so what I like to do is use my hand and show my fingers and think of my fingers as the cells of the small intestine. And you have these tight junctions in between the fingers or in between the cells of the small intestine, holding them together. And when you have that leaky gut, you have damage to the tight junctions. And so if you open up those fingers, or again, you have the spaces in between the small intestine become larger, and this allows proteins and other larger molecules to pass into the bloodstream, which causes an immune system response. So what causes a leaky gut? Well, there are a number of different factors that can cause a leaky gut, and this leads us into a discussion of the 5R protocol, which discusses the different things you need to do to heal the gut. And the first component also relates to some of the causes of leaky gut. And that very first component is remove. So again, remove the first R of the 5R protocol. So you want to remove those factors that can cause a leaky gut. Food is one of the factors. So I have an episode in this series dedicated to food triggers such as gluten, corn, other ones. Again, just definitely tune into that episode. Infections, certain infections can also cause a leaky gut. And I have an episode in this podcast series on lowering and normalizing thyroid antibodies that talks about infections as well. Not all infections cause a leaky gut. So in that episode, not every infection I discuss will cause a leaky gut, but ones that are specific to the gut can cause a leaky gut. And then even not necessarily infections, but small intestinal bacterial overgrowth or SIBO, yeast overgrowth also could be a factor. Environmental toxins, again, certain environmental toxins. So I have an episode, of course, on environmental toxins when it comes to lowering and normalizing antibodies, but it doesn't mean that every single environmental toxin will cause a leaky gut, but one that potentially can, glyphosate. Now, glyphosate, to be honest, I don't know if there's evidence of it directly causing leaky gut, but it definitely seems to cause dysbiosis, imbalance in the gut flora, and that seems to go hand in hand with the leaky gut. I mean, you could have imbalance in the gut flora without having a leaky gut, but many times when you have that imbalance, you will have a leaky gut. Medications are certain medications such as antibiotics, proton pump inhibitors, even anti-thyroid medications such as methimazole, PTU. Again, there's a time and place for medications, including anti-thyroid medication, but they can not only cause that dysbiosis imbalance of the gut flora, but there is some evidence that shows that they could affect that intestinal barrier, affect those tight junctions. It's also important to understand that you can have a leaky gut without experiencing any symptoms. So, if you're having symptoms such as bloating, gas, stomach pain, I mean, that again, you could have other things going on, such as parasites, H. pylori. I mean, H. pylori typically will cause heartburn, reflux. But again, even with H. pylori, you might not have symptoms. But the point is, you can have a leaky gut in the absence of digestive symptoms. So that's the first R of the 5R protocol. And again, some of those factors can be a cause of a leaky gut. So you definitely want to remove those factors. The second R, the second component of the 5R protocol is replace. So you might need to replace things such as digestive enzymes. A lot of people have low stomach acid. So maybe taking something like betaine HCl or taking some bitter herbs. Those are some examples of things that you might have to replace. Even dietary fiber falls under that replace component. So the third component, or the third R of the 5R protocol, re-inoculate. So you want to re-inoculate the good flora with probiotics, prebiotics, and you want to do, I mean, the question you might have is, should I do this through food? Should I do this through supplementation? You definitely want to do as much as you can through food. So if you enjoy eating fermented foods, for example, and if you're able to tolerate fermented foods such as sauerkraut or fermented pickles, then by all means eat these foods. And prebiotics, eat plenty of foods that are high in fiber, and that'll provide prebiotics. So, like for example, if you're eating vegetables, green leafy vegetables, which I do add to my smoothie, they're not the best source of dietary fiber or not really high in prebiotics. But then other types of vegetables like cruciferous vegetables, very high in fiber. Now, again, some people might not be able to tolerate cruciferous vegetables, especially if they have something like small intestinal bacterial overgrowth. Or, I mean, again, you just got to listen to your body. Fermented foods, same thing, or it could also be histamine intolerance. But definitely try to do as much as you can through diet. That being said, I do like supplementations. I've been taking a probiotic supplement for quite some time. I would recommend, if you do take a probiotic supplement, to take one that has a decent potency, at least 25 to 30 billion CFU, which stands for colony forming units. And also make sure it lists multiple strains, not just a species. An example of this, Lactobacillus acidophilus is a species. Lactobacillus acidophilus LA-14 is a specific strain. So you could just look at the label, and if you see just the species, and usually with the strain, you'll see like a letter number combination. Sometimes maybe just numbers or extra letters, but you definitely want it to list the strain and not just the species. And prebiotics, I mean, I can't say when I dealt with Graves in 2008 into 2009, I did not add extra prebiotics. I just tried to get what I can from the diet. But for the last, what is it, like 6, 7 years now, I've been adding prebiotics to my smoothie. And they're the ones I get are inexpensive, especially compared to probiotics, and just providing some extra prebiotics. Again, I try to get as many prebiotics as I can from food as well, but just also use supplements too in combination. So the fourth R, or the fourth component of the 5R protocol, repair. So you want to do things to repair your gut. And so a lot of people just jump right into repair. They'll do things like drink bone broth or take supplements such as L-glutamine or other gut healing supplements. And if you're a vegan, vegetarian, and you're not going to drink bone broth, cabbage juice is an option to also help to heal the gut. But again, you need to address the first three R's. Now, don't necessarily need to do these in order. So you could remove, replace, re-inoculate, and at the same time repair. But if you just jump to repair, like if you just are drinking bone broth or taking a gut healing supplement, like my SMT GI Restore, which is a great supplement, but if that's all you're doing and you're not doing things to address the cause of the leaky gut, as well as replace and re-inoculate, then you're not going to be successful in healing the gut. So repair is important, but a lot of people just jump right into that repair component of the 5R protocol, and they don't address the other ones, or they might take probiotics. I mean, I see a lot of people when they work with me, they're already taking a probiotic, a digestive enzyme, and maybe drinking bone broth, but they haven't really done as much as they could to address that first R, which again is remove. And then the fifth R of the 5R protocol, rebalance. Rebalance the parasympathetic nervous system. And you could do this through mind body medicine, vagus nerve exercises. So, what mind body medicine, meditation, yoga, even deep breathing. When you talk about vagus nerve exercises, singing loud, either in the shower or in your car or wherever. Vigorous gargling also could stimulate the vagus nerve, taking cold showers as well, which is something I do. So those are the five components of the 5R protocol. And this is necessary for optimal gut health. And some people will say, well, you need to go beyond the 5R protocol in some cases. And I mean, maybe, but you always need to incorporate the 5R protocol. So I'm not saying that in every case, if you just incorporate the 5R protocol, that alone is going to heal the gut. Many times it will, but if you try to do other things and not incorporate the components of the 5R protocol, you really aren't going to be successful in healing the gut. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. We also want to be aware of childhood factors that can impact the gut. So, for example, C-section versus a natural birth, being bottle fed, which was the case with me. I was never breastfed. And so that, I mean, if you're breastfed, that has beneficial impact on the gut microbiota. Antibiotic use when younger. So again, I took a lot of antibiotics when I was younger, which definitely wasn't beneficial to my gut microbiome. Proton pump inhibitors. Again, I don't know the statistics with children, but again, you'd be surprised how many children take acid blockers. They just go to the doctor, and just because, again, a lot of children aren't eating well, so a lot of it does come down to diet. And so if they have symptoms, many times the doctor won't look to make recommendations, or practitioner. It might not be a doctor, maybe it's a nurse practitioner or PA, but again, natural healthcare practitioner. But natural healthcare practitioner would hope it would be making dietary recommendations, but just going to conventional medical doctor or nurse practitioners, a lot of them are open-minded, but not all of them. So again, they might just recommend some medication, and that could have a negative impact on the gut. Again, time and place for antibiotics. I mean, when I was growing up, I'm sure some of the antibiotics I took maybe were necessary, but definitely not all the antibiotics I took. And so that's a big problem, not just with children, but adults as well, taking too many medications overall, not just antibiotics. How about testing the gut microbiome? Should you do any testing? I think it does depend on the person. I mean, there are natural healthcare practitioners, functional medicine practitioners who will test everybody's gut microbiome. And I won't say that's a bad thing. It's just that doing functional medicine testing isn't cheap and everything adds up. So to me, it's a matter of prioritizing. There are practitioners who will recommend leaky gut testing for everyone. There are practitioners who recommend a comprehensive stool panel for everybody. And again, that's just their approach. I'm not saying anything negative. Now, with regards to leaky gut testing, I used to test, at one point, I tested everybody for a leaky gut. So a number of years ago, I would do usually the array number 2 from Cyrix Labs. That's their intestinal permeability test, which is a blood test. There are other tests. You could do zonulin in the stool, which is not a perfect marker. Lactulose mannitol test is a more classic test, which is not perfect. I mean, even the array number 2, I think it's pretty good, but I'm sure not perfect. No test is perfect. But I will say that most people tested positive for a leaky gut, which made sense since, again, I worked. I mean, I do work with some people with non-autoimmune thyroid conditions, but most of my patients have Graves or Hashimoto's. And so, according to that triad of autoimmunity, you would think that they would have a leaky gut, and most people did. And what I decided to do eventually, I just stopped doing it because it's like, well, it's great for the person to see that they have a leaky gut, but it's a couple of $100 for the test. And why don't they just spend that money elsewhere? And we'll just assume that they have a leaky gut. I mean, the one upside of doing leaky gut testing up front is that if it's positive, later on you could retest it and then see if it improves, which it hopefully will improve. And now you could still do a leaky gut test later, even if you don't do an initial test, but you wouldn't know if it's positive to begin with. But I will say that most people did test positive for leaky gut, but if they were negative for a leaky gut, I would question whether it was a true negative or if it was a false negative or if it really was negative. So again, I just make the assumption that people have a leaky gut, and a lot of practitioners take this approach as well. There's other types of tests, comprehensive stool panels, such as the GI map, or there's also the GI map by Diagnostic Solutions, the GI effects by Genova Diagnostics are two of the most well-known tests. There's also one, I forgot, there's a newer one from Doctors Data. So, I mean, I do like the GI map and I like the GI effects. Those are probably my two favorite tests. Again, I don't recommend these tests for everybody. There are some practitioners who recommend for everybody, but again, they're expensive tests. And I mean, that's not the reason I won't recommend it. I mean, if I think someone needs a test, I will recommend it. Now, the challenge is sometimes you don't know because you can't always go by symptoms. So that you could use that as justification that everybody needs to get or should get a comprehensive stool panel, for example. But I look back at when I dealt with Graves' disease, I didn't get a comprehensive stool panel. I didn't get a leaky gut test. I didn't get any really gut related tests. I did saliva tests, adrenal saliva tests, which did look at a marker called secretory IgA, which lines the mucosal surfaces of the gut, and mine was depressed. So I did have that test, but I didn't have any specific gut testing like a leaky gut test or a stool panel. And I did fine. Again, I was able to get into remission, and I've taken that approach with a lot of people. And again, if someone has obvious symptoms, digestive symptoms, then I will usually recommend some type of gut test, whether it's a comprehensive stool test or a SIBO breath test, small intestinal bacterial overgrowth breath test, or looking maybe doing organic acids test, which is really good for looking at yeast overgrowth. So I will do some testing, or many times I'll give an option. Well, I'll list that, let's say, comprehensive stool test as an optional test, and someone might choose to do it. Now, if someone doesn't choose to do it, yes, there's always a chance that they might need to do it later on. So that's why I also give as an option. But to force everybody to spend $300+ on a comprehensive stool test, for example, when many of these people won't need it. Again, to me, I don't feel comfortable doing that. But if someone absolutely wants to do it, or again, if I feel like they need to do it, then I will give that recommendation. But yeah, like I said, you can't always go by symptoms. So sometimes I won't recommend it. The person might not be progressing or might hit a roadblock, and then we recommend it later on. And yeah, it would have been great if they did it initially. But like I said, that's just my approach where I don't recommend it to every single person. But if you listen to this, and if you in the future decide to work with me, again, just keep in mind it's up to you. You can do it, and usually I will list it as an option when I send my follow-up recommendations. There's also tests looking at the diversity of the gut microbiome. So like a GI map or GI effects, it does look at some of the good flora of the body, but its main focus, I would say, is looking for pathogens and opportunistic bacteria. So things like H. pylori, even though with the GI effects, that's actually an add-on. Parasites, again, certain opportunistic bacteria like Streptococcus, Staphylococcus, Klebsiella, Pseudomonas. Also looks at markers related to digestion like pancreatic elastase, secretory IgA, calprotectin. So I do find the test to be valuable, even though I don't do it in every single person. The stool tests that look at diversity, they're just really focusing on the number of different microorganisms and just making sure that they're in good amounts, that they're not too high, not too low. So it's a more comprehensive. So a comprehensive stool panel, it's called comprehensive because it looks at a lot of other things. But if you're just looking at the diversity, like Again, Viome, Viome, they're not my favorite, but that test is looking really just at the diversity. They're not looking at things like H. pylori or parasites. And again, Viome, it's not that I dislike Viome, it's just that they give recommendations based on AI. And just right now, it's still, yeah, still not perfected, I guess you could say. So nothing bad about Viome. I think the information on the diversity is accurate, but when they give recommendations on like foods you should eat and not eat based on your gut microbiome and some other information, which I'm not sure is accurate. And this is also based on what they've said, like listening to some of their webinars and admitting that they're still using a lot of AI just to come up with those recommendations, for example. So next question you might have is, how do you know if the gut has been healed? This is a very common question that I get asked. And there's a few different ways. So one is if you did that initial leaky gut test, then you could do a retest and see if it's been healed. Or again, even if you didn't do a leaky gut test, let's say you made that assumption that someone had a leaky gut, you could still do a leaky gut test later on and see what that shows. And if it's positive, then the person's gut has not been healed. And if it's negative, assuming you believe in the results, like I said, false negatives are possible, but that's one way. Now, when I mentioned when I dealt with Graves, I did that total salivarius IgA or secretory IgA and a saliva test, which was really low, less than detectable. And then eventually I retested, and the first time I retested, it still remained undetectable. And then I made some changes to my diet. At the time, I was eating paleo because there was no AIP diet back in 2008 into 2009. And then when I retested after avoiding nuts for a few months, my secretory IgA was normal. So again, I'm not 100% sure, but I'm pretty sure it was due to the nuts because that was really the only change I made. And then option number two is, let's say you have Graves or Hashimoto's and your thyroid hormones are imbalanced, your antibodies are normal, you're not experiencing gut symptoms. When you get to this point, and again, maybe you didn't have gut symptoms to begin with, but you had the elevated thyroid antibodies associated with Graves or Hashimoto's, or maybe even for both Graves and Hashimoto's. And so, either way, if everything seems to be in balance, and if you were experiencing gut symptoms but no longer are, again, so that you could definitely do that, and that's almost what I use. Again, I did look at the secretory IgA and the saliva test. So I did, it's not like I absolutely did no testing, but as I mentioned earlier, I didn't do a comprehensive stool test or a specific leaky gut test. When secretory IgA is low, that usually correlates with a leaky gut, but it's not a specific leaky gut test. So hopefully you enjoyed this presentation on lowering thyroid antibodies by healing the gut. And I also hope you have enjoyed the entire podcast series on how to lower and normalize thyroid antibodies. Just remember that it's not always easy to lower normalized thyroid antibodies, but it is very possible. Thanks again for tuning in, and I look forward to catching you in the next episode.